The most common way that an ankle or foot fracture occurs is with some type of a traumatic event. There's a slip and fall or there's a twist. Usually it's painful. It swells up pretty quickly. Commonly, especially with ankle fractures, we can't even put weight on it. The way that an ankle fracture's treatment is determined is by x-rays, always, and commonly a CAT scan, a CT scan, which is like a three-dimensional x-ray. And that is to show us the fracture pattern. And different fracture patterns behave very differently. There is more and more research to show that the ankle is sort of a ring of stability. And so there are bones and ligaments. It's really important that the bones are fixed and then the ligaments are also tested. And so if the ligaments need to be repaired, those are repaired as well. Each fracture kind of has its own personality. And so we know that some fractures very commonly need a surgery, and we know that some fractures commonly do not need a surgery. Our bones respond to load. And so if you are walking on it, if you're loading it, it will keep the bone very active. And we know that certain fractures can tolerate that, and it is okay and good to walk on it. And we know that certain fractures cannot tolerate that. And so if we really want to strive for initial stabilization, someone will go into a cast. If we know that stability is less important and we want to keep people moving and not let them get too stiff or under-rehabilitated, then you go into a boot that you treat like a removable cast. I think it's important that if someone sustains a fracture to their foot or ankle, that they see someone who has a pretty in-depth knowledge of the fracture's personality and the bone's sort of personality and how they handle fractures, because I think it avoids both over-treatment and under-treatment.